And I'm Art Kurland, Director Capital Asset Management for University Health. And we were the first NAAB accredited ISO 55000 hospital in the world. And like Mike said, I'm going to just talk about our journey a little bit. Like a lot of folks doing asset management for a really long time without even realizing that I was doing asset management. My background is in accounting. And so after this experience, it's really kind of fun in a way to look back at where we came from when there was virtually no asset management going on, at least formally, a formal system or program of asset management, and to see how far we've come. It's really kind of, again, fun to reflect on, and even more importantly, how we've been able to affect our patients and the community by sound asset management. University Health is partially taxpayer funded by Bexar County residents, and so having a ISO certification kind of gives some assurance to the tax base that we're good fiduciary stewards, and also we're helping to free up the doctors and nurses so that they can take care of our patients and not worry about any of their personal property issues that come up. So just a little bit more about University Health in terms of the scope of what we've been able to do. And San Antonio as well. So San Antonio is currently the 7th largest city in the United States. We're just 10,000 residents shy of surpassing Philadelphia to becoming the 6th largest city, and 165,000 residents shy of surpassing number 5 Phoenix. And estimates are that we will surpass Philadelphia to become the 6th largest probably by the end of next year. But University Health has a main hospital campus and over 40 clinics and other facilities throughout Bexar County. We also have call centers, business centers, tech centers, and so our presence is felt over 1,200 square miles of Bexar County. We've been recognized for our excellence in many areas, most of which obviously are healthcare related, but there in the lower right, you can see we achieved our ISO certification. And so this, I feel, was kind of important to part of our goal. As an organization, we're used to certifications and this type of programs to achieve excellence. So I think that helped as part of our journey, as part of the culture of the hospital. And so just to give you an idea about our main hospital, there on the lower left in the forefront is what we call the Sky Tower. It's a 11-story hospital, and behind it and to the left is a partial view of another tower we call the Rio Tower, and it's kind of shaped like an X or a cross. So what you only see one wing there. There's 4 wings. There's one wing that's directly affixed to the Sky Tower where there's access between those 2 towers. And then off to the right and directly behind the Sky Tower is another wing that's affixed to another tower we call the Horizon Tower. And that's a 12-story tower, and so is the Rio. And there in the center picture is construction currently underway to erect a 4th tower, and the artist renditioning is there in the lower right. That's going to be a women and children's hospital. And so what we do in asset management is support all the clinical operations. as well as other support departments. We are under the finance umbrella. It wasn't always that way, and I'll talk about that as well. But the point here is that, a hospital is kind of like a self-contained small city. I mean, we have our own police department, we have our own cafeteria, we have other, restaurants, gymnasium, laundry facilities, and so forth. It's busy 24/7. And the thing that differentiates a hospital between a small city is that nobody wants to be at the hospital. And so that's not really a joke. We understand that. And so what we try to do, and what particularly in our department, we are constantly reminded of that. Nobody wants to be here. And so we try to make our patient experience as positive as possible along with our visitors. And so the hospital and clinical facilities and operational facilities throughout the county is filled with a lot of different kinds of assets. I just affectionately call it stuff. There's just a lot of stuff. Things that you're familiar with. You can see on the right, the picture of an operating room. And then some things you might not be so familiar with on the left. Those are actually robots. And if you can see in the far back of the picture are some carts. And these robots are programmed daily to find their respective cart and take it to a predetermined destination. And they carry all kinds of things, from medical supplies to biohazard materials to trash. And when I first got here, materials management, logistics were the people that were handling the assets. And of course, they did the best they could, but they weren't trained in asset management. They were trained in logistics and materials management. And so that was there was an asset management department, but it was essentially just a name only with a couple of people in it. And so when I got here, I was observing some of the processes that logistics were doing that I saw immediate room for improvement. The logistics folks were doing the tagging of the assets, and the way they were doing that was essentially filming with a camcorder, the asset tag being affixed to the asset, and then the camera would record the serial number as well. And then the entire camera was transported to the asset management department, where there was a staff member that watched the video and would manually key in the asset tag and associated serial number into an Excel spreadsheet to the relative asset that was purchased. And so what happened was a lot of times the cameras never made it to the asset management department because they were stolen or they were just dropped and broken. And so on that Excel spreadsheet, there were huge gaps of missing data. And so I saw that as an immediate need to be improved. And the other thing that I saw too, coming to work every day, is I used to park near the dock, and I would come in through the dock, and I would see in the morning, for example, there'd be a set of chairs there just appeared to come out of nowhere overnight. And then the next day, the chairs would be there, and so would some cabinets. And the next day, the chairs, the cabinets, and then maybe some vital signs machines were there. And this was occurring day after day until one day I'd come in and it's all gone. And then the following day, the cycle started again. And I sat down to talk with the dock manager, and I asked them, kind of what was going on. And I was told that the clinical staff would come down and just during the middle of the night when there were no dock workers around, and they would just leave this stuff there that was damaged or just broken, what have you, just not needed, and they would just leave it there and until it became obstruction, and the dock workers were not able to move around, and they just literally threw this stuff away. And so I saw immediate need to improve there. And I was familiar with ISO 55000 from my from the early stages when it was in draft form. And I thought this was a good way to start implementing some policies and procedures regarding acquisition and disposal in terms of the life cycle. And when we took a hard look at how assets were or are supposed to be managed, we kind of gave it a life cycle. And I'm sure this would differ depending on the hospital or organization, but this is kind of how we defined our life cycle of an asset, from acquisition through disposal. And then as a, part of the standards, a way of monitoring and reporting. And so the life cycle, for those accountants out there or those that are familiar with accounting for capital assets or fixed assets, you know that there's a roll forward, and it begins with a beginning balance, which is the prior year ending balance. And then you have additions, transfers, disposals, and then you have your new ending balance. So we incorporated some of that to have our acquisitions, our transfers, and disposals, but we realized that there were other life cycle phases, we'll just call it. And it's not just capital assets that we felt needed to be tracked and reported on. There were also what we call controlled assets, and these are assets that just fall under the capital threshold, but they're important to just maintain a history of. And you can see as in the pictures, there's laundry, there's housekeeping, there's just a lot of stuff in the hospital, and we use the same life cycle for all the different types or categories of assets. And so that kind of was the beginning of our journey in to ISO certification. We actually started off the certification process with a limited scope in just solidifying our acquisition process and our disposal process. And then the thinking was we'll take care of all the stuff inside in between at a later date, which is what we did. Kind of, if you think of it as a house, we wanted to secure the front door and the back door, and then we'll tackle the stuff inside the house later. And so currently, initially, our certification scope was in the management of asset acquisitions, delivery, and disposals. And since then, we've been able to expand that scope to all those life cycle phases. And now our scope certification, it actually reads the management of life cycle, personal property life cycle, the entire cycle. So in the very beginning, like I said, we had an asset management department, but it was really in name only. Our materials management / logistics was handling that the asset management portion, the tagging, and not much else. But to their defense, that's not really what they're supposed to be doing. In logistics and material management, their prime objective is to get all the supplies to the clinical staff. And so they're very good at doing that. And that's what they were doing. The asset management part of it would kind of just, unfortunately, took a back seat because it had to. There was really no system in place. Like I said, there was a Excel spreadsheet, and to it was basically an inventory list, and that was it. Like other big or large organizations. Some of the departments were just worked in silos. And again, there was no training for the staff that I inherited. And so just as I go through overcoming some of these challenges, just know that there's really no sequence to it. There's many things that can be done at the same time or simultaneously. But always in finance, the question is going to come up, how much is this going to cost when I approach senior leadership about going forward with an ISO certification. And so being armed with that information is something that I would suggest everyone kind of know if you're interested in going in that direction. But anyway, to our benefit, like I said earlier, the hospital, part of the culture was geared towards achieving excellence and recognition. And so when I approached the leadership about obtaining ISO certification, they were already familiar with certification, and they liked the idea of being recognized for our efforts. So in that respect, the idea was embraced really immediately. And then, of course, the question came up, how much would it cost? And so after revealing the cost, which I had done my homework, and part of a public entity, you kind of have to put out a request for proposal. So and then you go through a scorecard, and so we already did that as we were improving the acquisition, delivery, and the disposal processes. And so I explained to them what we were able to do really on our own as a department, and how much we improved that acquisition and disposal process. We no longer were using cameras. That was really a high risk because of some of the reasons I stated, just missing a lot of information. We automated a lot of the acquisition process by working with information technology and the logistics department. Ultimately, what occurred was we were able to, and we were able to integrate we went away from the Excel and we got our own database, and we were able to integrate some of our systems where we had the PO information already from our procurement system, and then our when the tagging occurred, that the asset tag was barcoded so it could be scanned, and then in a lot of cases the serial number was scanned and is barcoded so that it could be scanned, and those scans of the tag and the serial number were integrated into the purchase order system, which we were able to then get imported into our asset database. So the system was much more accurate, lost no data, and it was much more efficient and fast. And so we explained how we were able to improve on those processes, and then leadership decided that those small benefits that we were able to achieve basically on our own certainly outweighed the cost of going for a certification. And so on top of that, while this was all going on, I had my staff trained. They went to the National Property Managers Association and achieved their asset management certification as property managers. I actually made that part of the job description. I worked with human resources to put that in the job description of the asset management tech, and we gave our technicians a grace period to achieve that certification. And there's also other resources available that I know now that I didn't know then, like the Asset Management Council and of course the Asset Leadership Network as well, that could provide training. So just a really high again, this is all high level. There's a lot of weeds in every one of the bullet points that you said and that I talked about, and each one of them really would take a whole day of presentation on how we got from point A to point B. But again, on a high level, we observed some opportunities right off the bat, saw some poor processes that needed to be improved. We trained our staff, and then we achieved that leadership support at that point. And as well, we achieved departmental support, and the way we went about doing that was we explained. Well, first of all, we started with our common goal. When I approached the department heads, I said that, you know, the goal is to make the hospital to make it better overall. And so we agreed right off the bat, you know, that's what that department head's goal was. That was my goal. What my goal was to make the hospital better. So right off the bat, we started with a shared goal. And that's when I started, after that, explained asset management and how we can achieve that goal and help that other person's department at the same time. Same way logistics was helped by becoming more efficient, doing more with less, and just, again, making the whole hospital health system more efficient. And I found that to really be a good approach with all the department heads that I worked with, and there's a lot of them. And so some of the measurable achievements that we've been able to do is, like I said, saving clinical staff time. That's number one for the hospital administrator. That's what we're here for, is to focus on our patients, provide excellent care. And so our asset management efforts we were able to take some of those property issues away from the clinical staff and save, and part of our implementation, we implemented a work order system. So we were able to actually measure how much time we were saving our clinical staff. And so you can see on the screen that on average, about 700 hours a year, we save clinical time so that they could focus on our patients. We've also been able to increase our revenue from unneeded assets. They're no longer just left on the dock to be thrown away. We assess them. We make an informed decision on whether or not we should reuse them in another department, if we should sell them, or maybe they are just beyond their life and maybe they do need to be thrown away. Maybe we can get some value from recycling. So, you know, we're able to, on average, bring in an additional $250,000 a year from auction sales. We save by approximately $250,000 from reutilizing our assets, and we know this to be sure because when we revamp the acquisition process and we capture all the PO information, we know when an asset is being disposed how much it costs to begin with. And so when we make it available for other departments to use and they choose to reuse the item, we know we save our organization from having to purchase a new asset, and we know how much we save them. We are good environmental stewards. We recycle as much as we can. If anybody working in a hospital knows that space is a premium because of our processes. We manage our space efficiently. Things don't just sit around. It's not out of sight, out of mind. Their assets they're either used or going to be used very soon, or they're gone. We updated our corporate policy, and this was part of the process of getting certified. A couple of things occurred during the gap analysis. And that's why I think it's so important that anyone who is going for the ISO certification, even if you're going to self-certify, I feel a third-party gap analysis is a must, because there's just so much that you can do that someone with a different set of experiences could point out. And so during the process, we updated our corporate policy per section 5.2, and we got the policy to include that that leadership is committed to continuous improvement. And just to emphasize the commitment that leadership made here, and some of you know that it's not really a simple task to update a corporate policy. It takes a very long time, and there's even a committee that's formed that reviews the policies, and everyone from the president and CEO and other members of the C-suite are all involved when it comes to corporate policies and upgrading them. And so to get this policy upgraded to include the verbiage that leadership was committed to continuous improvement really solidified us as just there was no returning from this process at this point. And it helped to communicate with other department heads as well that we are going to do this come hell or high water. Of course, you catch more flies with honey, so it never came down to that, but it was good. It felt good to know that support, that level of support was there. Another improvement that came out of the gap analysis, we formed the Asset Management Governance Committee per section 4.2 to make sure all our stakeholders' needs and expectations that were understood and were being met. And so every quarter we get together, the Asset Governance Committee. It's essentially made up of really asset-intensive departments like IT and biomed and hospital administration. And we talk about we go through what we call a risk matrix, and we talk about each phase of the life cycle and how any risks to those life cycles may have changed, among other things. That's primarily what we talk about, but any upcoming things that projects, things of that nature are also discussed. And then finally, we implemented what we call the Asset Management Advocate Program. We have over 300 departments in our hospital. And so this program really engages all the departments. And what it is it like a lot of big companies will have like safety advocates, for example, where when the fire alarm goes off, the person stands up and says, follow me out into the parking lot, and there's a designated space. So this program was kind of modeled off of something similar where we asked department heads to appoint an advocate in each department. And so we communicate with our advocates every month with just a short survey. Actually, it's a SurveyMonkey survey that just asks like 5 quick questions about the assets in their particular department. Things like, did you receive any assets that didn't have a tag on it? Or did anybody relocate to another office without a support department? Just those kinds of questions that is kind of like a safety net that helps us make sure that all of our processes are working correctly, because of course none of those things should happen. But sometimes some things fall through the crack, and that's our safety net. And so on a monthly basis, our advocates take these questions to their staff, because at least once a month, all the departments have staff meetings. And so we asked that those questions be asked during one staff meeting per month. And so it's more of a collective answer. It's not the advocate that's answering, it's the advocate that's answering for the staff. So the more eyes and ears that are out there, the better, as far as we're concerned. And so some of the lessons learned through ISO certification, I think we enhanced our reputation, as an efficient, good fiduciary tax for the taxpayer, and in other ways too, increasing the awareness of how to use ISO 55001. I think it was a surprise to a lot of people when we made the announcement. I believe that a lot of engineers were involved in creating the standard, and were under it's my belief, based on what I've been saying, that the standard was initially thought of to be used for plant assets and infrastructure assets, and so I think a lot of eyebrows were raised when we were certified for personal property assets, and it should really not be a surprise, because you can look at a building and think that that might stand there for 50 years, but the stuff inside the building might be refreshed anywhere from 3 to 15 times within that time frame. For example, in a hospital, a portable X-ray machine is probably about a $200,000 asset. We have like 25 of them, and so that's a $5 million investment, which could be refreshed conservatively every 10 years. So during that 50-year building, you got $25 million invested in one type of asset. So times that by all the different types of assets, you can see how personal property, why I'm so passionate about it. The other thing too is you have to be very patient. It's a slow process. If you were on yesterday with the Air Force's presentation, you heard that they were into it like 15 years already. It's a very slow process. Don't be afraid to make mistakes. We don't know what we don't know, and we're not going to know unless you try. And so if you come across any kind of hurdle or anything like that, just take a step back and think of a way around that hurdle.